Murray State Racers mask from West Kentucky, sent to me by President Bob Jackson. So thank you so much to everybody at Murray State for sharing this with me. Today I'm going to do the Fast Four at 4, share some good news with you guys. The very first thing that we're going to talk about today is the Teacher of the Year. Last week I got to participate in the awards ceremony for the Kentucky Teacher of the Year, sponsored by Valvoline. And for me, this celebration was extra special. Since March, we have asked teachers to do the impossible by completely reshaping the way they keep themselves and their classroom safe, how they interact with their students, and the method with which they deliver instruction. And they have answered the call. Teaching is the profession that makes all other professions possible. If you want to take a look at Kentucky's future, go visit the nearest classroom. More than 2,500 teachers were nominated for Kentucky Teacher of the Year, and the selection committee had a difficult task in narrowing down the applicants. However, 3 teachers stood out from their peers. The high school teacher of the year is Christopher McCurry, a 12th grade English teacher from Lafayette High School in Fayette County. The middle school teacher of the year is Laura Peevely, an 8th grade math teacher from Westport Middle School in Jefferson County. The elementary teacher of the year is Donnie Piercy, a 5th grade teacher from Stonewall Elementary in Fayette County. Donnie was also named the 2021 Kentucky Teacher of the Year. Congratulations to all of the nominees, especially these 3 educators. Next up, we have some exciting news, a little bit of a relaunch here, bringing more attention to the free GED program that we started what seems like a lifetime ago, but it was back in January. Our Commonwealth's economic future goes hand in hand with our ability to educate all Kentuckians, and that's why the Beshear Coleman administration believes that every Kentuckian has the right to a quality education. You will remember back in January that we announced the free GED program. Today we are announcing an exciting addition to the program that allows Kentuckians to earn their GED virtually. During the first 6 months of 2020, there were 3,565 Kentuckians who took advantage of the GED opportunity. I am proud to announce that 1,032 people have successfully earned their GED during the first 6 months of 2020. And I want to flag that leaves a gap of about 2,500. You can move through the GED program at your own pace. And so some of these folks are still processing through, going through that process to earn their GED. And as a teacher myself, I know that so oftentimes our students need a little remediation and a little help. And with that, they'll be successful the next time. And so we are currently working on plans to reach out to folks who made the effort and fell short and just need a little bit more help so that we can help to get them across that finish line and earn their GED. As a teacher, I cannot tell you how big of a deal that this is. I know that the difference between a high school diploma or a GED can make a very big difference in a person's life. Stats tell us that people who earn a GED make 37% more than those without it. Adults lacking a high school diploma or GED are twice as likely to be unemployed and 3 times as likely to live in poverty. Unfortunately, COVID forced the closure of Kentucky Skills U local offices and all GED testing centers in March. These closures prohibited aspiring graduates from taking advantage of the free GED offer. So the Education and Workforce Development Cabinet is continuing to allocate funding to waive GED test fees for first-time test takers. And Kentuckians now have the ability to complete the GED program virtually. This includes video conferencing and distance learning opportunities to help folks prepare for the test while staying safe from COVID-19. Through Kentucky Skills U, Kentuckians seeking to become college and career ready have direct access to adult education services at no cost. Our staff equips individuals to pass the GED by allowing students to learn at their own pace. With more than 327,000 Kentuckians without a GED or high school diploma, we have a responsibility to create opportunities that allow Kentuckians to thrive. Cost of the GED program and lack of transportation are the 2 top reasons that Kentuckians do not pursue their GED. By waiving the test fee for first-time test takers, we are eliminating one of those most significant barriers facing adults lacking education. We will continue to remove barriers that stand in the way of Kentuckians improving their future by continuing their education. This is one way we will build a better Kentucky for everyone. I urge all Kentuckians who are thinking about continuing their education by completing the GED to visit www.kyskillsu.ky.gov and click on County Contacts to find a Kentucky Skills U program near you. Third up, we have voting. We're almost there, guys. Tuesday is the 2020 general election, so we are just 6 days away. But as I've said before, every day between now and next Tuesday can be election day for you. As a civics teacher, I am proud of Team Kentucky and the work that we've done around making voting more accessible. Many experts are predicting a record turnout this year. If you plan to mail your absentee ballot, it must be postmarked by Election Day and received by November 6th. I recommend, if you can, to take your absentee ballot to the drop box in your community. Check with your county clerk's office to find the nearest location. And speaking of county clerks, I want to say a special thank you to all of them. The governor and the Board of Elections and the Secretary of State have worked together on a bipartisan plan to make voting safer and more convenient, but none of this would be possible without our local county clerks and their staffs working around the clock. Many of their offices are underfunded and as a result understaffed, but their commitment to their communities and our right to vote, at the very least, deserves acknowledgement and appreciation from all of us. So visit govoteky.com to find information such as the status of your absentee ballot, locations where you can drop off your ballot, local polling places in your community, or to view a sample ballot. And last but not least today, we've got Mask Up KY, so I want to show you some good examples of folks who are doing the right thing. So first, we have our friends at the Madison Kindergarten Academy that are using Baby Yoda here to set an example for the proper way for students to wear a mask. And I know my family is especially going to love this because they love Star Wars. But these little kindergartners are showing their support there by doing it the right way. So we thank you to Candace Young, the PE teacher there, for being a good example for your kids. And second, we have Shannon, who has shown us a picture of her beautiful dog. We really don't deserve dogs; they're just too cute. But showing all of the different ways that you wear a mask to make sure that you are protected. So we appreciate Shannon helping to use this cute guy as an example for wearing your mask properly. So everybody make sure that you continue to wear your masks, socially distance, and practice good hand hygiene. And I'm going to now turn it over to Secretary Friedlander.
Thank you. I'm wearing my own mask today. This is my Connect mask. And remember, Connect is where you can find benefits for the Cabinet for Health and Family Services. So today I am going to address once again long-term care. Long-term care in Kentucky is a challenge. Long-term care in the nation is a challenge. Long-term care in the world is a challenge. But we've been working hard. And we have some guidelines around visitation where we want to talk about how to encourage more outdoor, weather permitting visitation. And we have some funding to help facilities alter some of their outside areas to allow for that. And we're aligning all our visitation policies with the CDC prevention guidelines. We've provided a great deal of surveillance, a lot of testing for our long-term care facilities. I've discussed that earlier. But since this August, by the end of the week, we should have over 330,000 tests that we provided for residents and staff in long-term care. This is important to identify where infection and outbreak is occurring and what steps these facilities need to take in order to begin to address an outbreak in their facility. In counties that are red, and there are a lot of them, this means twice weekly staff and resident testing, following the guidelines that we support. In orange counties, it's weekly testing of staff and residents, again, following our guidelines, and again, with our support. Facility activities, communal dining, some of the group activities, under pretty severe modification around masking, disinfecting, and social distancing, like many of our other facilities. We've begun our annual recertification surveys, and I would be remiss if I didn't at this point say thank you to the long-term care staff members. Your job has been hard, and you've hung in there. And we, families, residents, appreciate your fortitude. Families and loved ones who have had to come through this without visitation, this has been hard. It's been hard on all of us. And to save a life, to save a loved one's life, this is why we need to do this. So, next slide. We've ended up about 26th, and normally Kentucky is somewhere in the 40s for prevalence in long-term care. We're in the low 20s relative to our death rates. It's because of folks working hard in these facilities. We can do better, we should do better, but here's how. All of you can help. All of you need to wear a mask. All of you need to practice social distancing. What is important now in terms of what's happening in our long-term care facilities has to do with our community spread. If you are in a red county, please, we've talked about our guidelines, we're going to talk about them again today, follow our guidelines. This is probably, the community spread is the most important factor in what happens within facilities in specific counties. Please, wear a mask. Please follow our guidelines. Because we've talked about the veterans' nursing homes. We've talked about these facilities located across the Commonwealth, and they are very good facilities. And we have an outbreak in one. We have an outbreak in Thompson Hood, in Wilmore. This is a big facility. It's probably the largest facility in the state, 285 beds. There are other facilities, as you see, and actually those other facilities are doing really pretty well. 3 of the 4 are seeing minimal cases, and in Hazard, there have been no positive cases since August. Now in Wilmore, there are 55 veterans that are currently positive. We've lost, we believe, 12 veterans there. 25 staff are currently positive, and we support them too. Our Inspector General's office has gone in and done infection control surveys and consulted with them 4 times. They're always on the phone with our hospital-acquired infection team under Dr. Stack's guidance that work with all facilities, but have been working very closely with Thompson Hood. So these phone calls have been tremendously important. We're providing support on testing. We're providing the Binax antigen as well. So there are lots of resources that we are giving them, and it's not just us. The Veterans Administration, we have our own state strike teams, but the VA has strike teams too, and they're very impressive. They're primarily nurses, and they come from all across the country. So folks all across the country volunteering to help us, to help our veterans here in Kentucky. It's a very, very impressive response. So with that, the folks in these long-term care facilities we've seen across the Commonwealth, some of the best ones have had significant outbreaks. This is a great facility. But we have to do our part. We have to wear our masks. We have to follow the guidelines. And that's the best way we can give back to our veterans and protect them. Thank you.
All right, thank you to our Lieutenant Governor. Thank you to Secretary Friedlander. And I hope what people take away from the information he just gave is it takes an entire community to protect the most vulnerable, to keep our schools open, to keep our economy running. Even with all of the testing that we are doing, more than we ever thought was possible when this began in our long-term care centers. Even with restrictions on visitation, which are hard for people, we're still seeing the virus get in. And that's because if your county is red, maybe even orange, and the community transmission is that high, it's going to find its way in. So that just adds to what we need to see from everybody, that when that county hits red, that everybody comes together in a coordinated effort. That's our long-term care facilities following guidelines, that's our schools following guidelines, and that's our government, businesses, entire community following guidelines. If we can do that, if we can come together, we can make a difference in our local communities. Not just protecting nameless, faceless people somewhere in Kentucky, but protecting the people you see every day. And that's really important today, because let's pull up our incident rate map for today. As of today, we have 64 red counties. Now, Thursday is the day that counts. It sets what we ask for next week. But 64 red counties, 47 orange counties, 9 yellow counties, and 0 green counties. That shows you that we have a significant spread across Kentucky, and we need our communities, again, everybody doing their part in each of these areas to bring those levels down. In fact, if you look at all this, you'll see why later when I give the COVID report, we are now over 6% in our positivity rate, something we have not seen in a very long time. So let me reiterate from the last couple days we've been talking about this. This is how the red zone recommendations work. Tomorrow, at this news conference, we will show you the official Thursday map, and we will list the red counties. For those red counties, the recommendations have already been out there for schools to go virtual the next week. The recommendations are already out there for long-term care to restrict visitation. But now there are also these additional reduction recommendations that go from government to business, and they align what we're doing. If kids are going to be learning from home, if parents can be working from home, that helps the family, but it also reduces the maximum amount of contacts, and it tells our families, let's cancel having people over that next week. We got to do our part to help our community, knowing that that person that comes into our house too has a much higher chance of having COVID based on where things are. This is how we protect ourselves for that week and ultimately tamp down the virus. So tomorrow, 4 o'clock, we're going to announce the red counties that we are asking to take these steps as a united community, and that's what it's going to take. Again, this isn't just helping people out across Kentucky. It's helping people out that you see every single day. And it's necessary because we continue to see significantly high cases. But for the backlog in a previous Wednesday that we saw, this would have been the highest Wednesday, which would have followed the highest Tuesday, which followed the highest Monday, which followed the highest Sunday, which followed the highest Saturday. And that's where we are seeing cases right now. Today we're reporting 1,864 new cases of COVID-19. We've now not just surpassed 100,000 cases, we're at 101,494. We have 927 Kentuckians in the hospital because of COVID-19, 235 in the ICU, and 110 are on a ventilator. What we see is a percentage, and I was looking at it today, of everybody who gets this virus ends up in the hospital, ends up in the ICU, and I think it's 1.4% right now end up dead. 1.4% may seem small, but 1.4% of a really large number. Still a large number, and a lot of people lost. Today's test positivity rate, 6.07%. Now, the school guidance that we put out talked about it being applicable if the rate was under 6%. We're going to continue to apply it for this next week. And there are a couple reasons in that. One is it's not that much higher than 6% at the moment. But second, we're going to have so many red counties that it would be where our advice would be anyways, that there's going to be a widespread call based on the recommendations for us to work really hard next week. We, in new cases by county, and again, we read off the double-digit counties. It's going to take a little bit because there's that much COVID in that many counties. Jefferson, 352. Fayette, 102. Hardin, 78. Nelson, 67. Pike, 60. Kenton, 59. Warren, 49. Christian, 37. Bullitt, 35. Barron, 33. Boone and Davis, 32. 28 in Madison, Montgomery and Scott. 26 in Campbell and Knox. 24 in Jessamine and Marion. 23 in Hart. 21 in Henderson, Laurel, and McCracken. 20 in Clay and Lee. 19 in Franklin, Taylor. 18 in Boyd and Oldham. 15 in Rockcastle and Shelby. 14 in Bell and Callaway. 13 in Caldwell, Marshall, and Rowan. 12 in Hopkins, LaRue, Lincoln, and Magoffin. 11 in Martin, Monroe, Whitley. 10 in Floyd, Greenup, and Logan. And there's a lot more counties that have cases. Go onto our website, kycovid19.ky.gov to see the full rundown. When we have a lot of cases, more death follows. We've had a lot of cases over the last month or so. So today we're announcing 14 new deaths where COVID is a contributing factor. They include a 64-year-old woman from Knox County, a 91-year-old man from Henderson County, an 85-year-old woman from Lee County, two women, 180 and 182 from Kenton County, from Jefferson County, an 81-year-old man and a 70-year-old man, an 80-year-old from Breathitt County, an 87-year-old woman from Jefferson County, 83-year-old man from Boyd County, 95-year-old woman from Fayette County, 80-year-old man from Jefferson County, 61-year-old female from Christian County, and a 93-year-old woman from Henderson. So we look at our long-term care facility update today. Secretary Freelander talked about the steps we are taking in these facilities. 105 new residents, 60 new staff have tested positive, 9 new deaths attributable to long-term care. I do at some point want to show a graph, though, where the percentage of cases that are non-long-term care as compared to long-term care, the number of deaths has increased. More individuals now, as a percentage that are not in long-term care, are passing away here in Kentucky. So this isn't just a virus that hits those that are in these facilities. It's killing others as well. With these types of numbers that are out there, the White House has given some recommendations. They're similar to ones that we've seen recently. Number one, and again, this is despite committee hearings we have where some of our leadership in the legislature doesn't believe the mask requirement should be in place. The White House does. They're in the same party. They claim to support the White House. The White House specifically says in their guidance, keep our mask mandate in effect. Without it, this thing would spread even worse. Ensure physical distance. Avoid public crowds and private social gatherings. Again, this is their advice. And ensure retail establishments are complying with guidelines. This is the first time we've seen this one. The White House asking us to continue to enforce the mask mandate. And we've got some retailers that, it's tough to enforce this, and sadly, sometimes their people get threatened, and that is not okay. And I don't want to put anybody in that position, but we really need our retailers and others to say, if you're not going to wear a mask, we're not going to seat you. We're not going to check you out. That's the best way that we can get compliance back up again. Here's another thing that was in this White House recommendation for the first time, and it's something we've been saying for a little while, and that's that current transmissions are linked to home gatherings. So it's not just Andy Beshear or Stephen Stack that's been up here saying that those groups that you have over to your homes, those neighborhood parties, they are spreading this virus with a large number of cases linked to them. So with Halloween coming up, if you're having a Halloween party, the state believes you're spreading the virus, the federal government believes you're spreading the virus. Don't spread the virus. We need your help. We do have some positive news on the testing front. We're announcing a new program today for surge testing, which will be helpful with our number of cases that are continuing to increase. We'll have additional testing in Louisville and in Lexington, which recorded the highest number of cases today. The testing is going to begin tomorrow in Louisville at the Kentucky Exposition Center, so people can go vote early and get their COVID test all at the same time. There will be 200 tests available tomorrow at this facility. These are drive-up PCR tests, so they are highly accurate, and there'll be 300 each other day through Saturday, and then they will resume next week after taking Sunday off on Monday. There's going to be a Lexington site that we'll announce in the near future that starts on November 9th. We're just working out location details. The testing will be from 9 a.m. to 5 p.m. Federal, state, and local healthcare workers will staff these sites. Again, they're PCR tests, high-quality tests, where you can get your results in 2 to 3 days. Each patient who is tested will receive a pack with 5 cloth masks provided by the U.S. Department of Health and Human Services. People can register for this testing, which the federal government is helping us on, and we should give them credit. They called up and offered additional testing to us, and we said absolutely at www.doineedacovid19test.com. Much of our current increase is through asymptomatic spread, and so this is an important way to see if you have this virus but don't know it. So again, this Louisville location, open tomorrow, is an opportunity for people to both go and cast their ballot and get a COVID test. You don't have to be going to cast your ballot to get the COVID test, but we need everybody to vote early this week at low-density times. We don't need a crowd next Tuesday. With this much spread, I think a lot of people should be interested in going and getting tested, even if you're not feeling bad. There are testing locations all across Kentucky. I'm just going to point out the ones that the state is helping to sponsor. First, these are our 4 new regional testing units. They're designed to reach areas where we did not have enough testing. They are now all up and running, and as you can see with those websites, that's where you go to sign up for a test. What it's gotten us is the purchase area, the Ashland, Boyd County area, Lee, Wolf, Owsley counties, which have not had as much testing, and then we get Hardin all the way to Breckenridge and Grayson as well. With these 4 facilities, along with all the others we have in the state, over 200 now, we should have a reach everywhere for you not to have to drive more than 30 minutes or so to get a test. Again, you can see the number of locations. Let's go back to Louisville and the other testing locations since we have seen so much spread. So now, 200 tomorrow, 300 on other days at the Exposition Center. But those aren't the only areas. There are the ones with U of L, which is 3 additional testing locations, all drive up. You can sign up by phone at this number or by going online, again, downtown South Louisville and Bullitt County, all with significant number of tests. There's also the Norton drive-through testing, and that one's doing 600 plus a day. We need people to continue to go to that as well. We'll get up that. Okay, so that is the Northern Kentucky testing, which we would get to as well. Again, this is drive-through testing in Northern Kentucky supported by the state. These are the 2 Northern Kentucky drive-up testing locations. We're seeing a really good job being done in Northern Kentucky when you compare it to what's happening right over the river, but we need to keep that up, which requires continued testing. This is the Norton and how you sign up. There's the online and the phone number. Can we go to Lexington with the testing we're doing with UK? Again, this is how we sign up there. And then let's show Northern Kentucky one more time. So a lot of testing opportunities, and I will tell you right now, we are doing a significant amount of testing in Kentucky, but with this amount of spread, with this amount of red counties, we need you to get tested so that if you're positive, you're not spreading it to other people unknowingly. So please check out those options. Now I'm going to ask Dr. Stack to come up here and to talk about our red county recommendations from his perspective, and then we will open it up to questions.
Thank you, Governor Beshear. Good afternoon, everyone. If we could put up the incidence rate map, the one from today, please. I only have 3 images I'm going to show you tonight. The governor showed this to you. There's 64 red counties, 47 orange, 9 yellow, and 0 green. This is the worst this map has ever looked. And every indication would suggest that it's going to get worse before it gets better. You know, it's difficult. I've mentioned this before. When we go through situations like this and we're trying to advise the public during a difficult time, you want to be fact-based, you want to be calm, you want to try not to be sensational. All these things are important. And again, I emphasize these things because communication is what we say, but it's also what you receive, and it takes both of those for the message to get through. So I realize that when we communicate, and when I communicate, some people receive it as factual and evidence-based, and others, unfortunately, receive it as fear-mongering or trying to scare people. And I want to assure you, I have no interest in scaring anyone. I do want to, though, make sure you're as fully informed as I possibly can and why I personally believe, and why every public health person I've had the privilege to work with over this journey of over 8 months now feels pretty much the same way about where we are and why this is important and why this is dangerous. If you could show the next slide for me, please. The newest one that I put this in here for a reason. I think here in Kentucky, we could look around the world as we see it and say, well, the sky hasn't fallen, it's Chicken Little. The bad stuff hasn't happened here. And I think in some measure, at least when it comes in terms to total numbers of deaths, you can understand how people could maybe reach that conclusion. It's tragic that we've lost almost 1,500 people and that many Kentuckians have paid a price with their life, but it's not what has happened in other places. And so I ran this afternoon. And again, you've seen these before. Those of you who watch this, I've used these repeatedly. This is deaths adjusted by population. All right, so this means all the states in the United States, we adjust it for population, so that nets out the more dense ones or the more thin ones. New York's at the very top. They got hit at the very beginning, and they got hit the hardest by any measure. Then you go down there and you see Arizona and Florida and Texas. Now, Texas is probably about 2.5 times higher than we are. Florida's about 3 times higher. I don't know, I can't do from this distance what Arizona is, but New York is about 6 times higher. Now, I put all those shaded lines at the bottom. Those are the bottom 25 states of the United States. We are in the bottom 20 in the United States. So if you were to look, we have done much better than 30 or more states in the United States of America, and we have done extraordinarily better than the states that got hit the hardest. Now, New York was at the very beginning, and that's such a long time ago. The others got hit the hardest in the summer when we'd learned a lot and we knew what we could do to protect ourselves, but folks decided to remove restrictions more quickly and not follow these guidelines, and a lot more people in their states paid for those decisions with their lives. I'm not here to criticize others for the difficult choices they've made. This has been hard on all of us, and I think the leaders are trying to do the best they can across different places. But we know what works. We know that the tools we have now, as frustrating as they are the ones that help keep us safe. It's keep people away from each other. We say 6 feet or more. Wear masks whenever you're close to someone. Wash your hands. And we add these other things which are so important. If you are sick, stay home. Don't go to school or to work to expose other people. And if you feel you've been exposed to COVID or have symptoms consistent with it, please get tested and follow the guidance. And so if you could put up the next slide, which is my final one, I'll make these points. We have a lot of guidance in place already, and the governor has already said this. We've reduced most every business there is to 50% capacity. Now, that's the negative side, is we're at half capacity, but the positive side is every business is allowed to be open and operating, every business. We recognize the importance of having people at work and having citizens have access to the services and the products that they need and want to consume. But in order to keep ourselves safe, in order to minimize this burden of excess death, in order to minimize the impact of shutting down hospitals because they get overrun, we have to do these things. So we're at 50% capacity, 6 feet space between people, mandatory masking when you're in public and when you're inside places of businesses, healthy at work guidelines for many major industries and businesses, healthy at school guidelines, large menu guidelines where when entities plan big things like university football games or inside basketball games for collegiate basketball. They come with proposals, we review them, we offer input, we set parameters, and they've worked with us very well to comply with those things. We're very grateful for that. There are plenty of guidances and mandates in place. The problem is people have to follow them. And so as we look at the Red County guidance, I want to put this in the big picture as I wind up. This is not just a Kentucky problem. It's not just a United States problem. It's a human problem. This is a global problem. If you listen to the news from around the world, humanity is struggling with this. Everybody wants it to be over. Everyone wants to get back to things. If we get that cavalier about it, we are going to get smacked hard. I've said this before. It's like being in the casino. The house always wins. The virus is the house. I don't have to stand here and guess that more people will be in the hospital and more people will get sick. I know it will happen. It's happening right now. We're setting records day after day in Kentucky, and what happens is 3 to 4 weeks later, after people have been in the hospital, then the deaths mount. And let me just put it in a different context, because I don't want to sound like I'm inspiring fear by talking about the loss of people's lives. A lot of people are paying a price because they have very long illnesses and they have prolonged symptoms. So yesterday, my colleague and the Chief of Staff for the Department for Public Health told a personal story. Rocky told a story about his father earlier in this journey. Kelly's husband has been sick for 3 weeks. This is not the common cold. He's not back at work, and it's not going to happen just next week that he'll feel well enough to go to work. Now, if taking a 40-year-old out of work for 3 weeks is just the common cold, then you and I have not experienced the same common cold. This is a serious illness, and we're having more and more people getting exposed to it, because what happens are folks get called by a contact tracer and they say, I haven't been in contact with anyone. And we all know that that is not true. And they don't comply. And then we have people want to say every business is essential. Well, yes, every business is essential and important, but they're saying it so they don't have to quarantine. When everybody tries to flaunt the rules, when everyone flaunts the guidelines, they don't work, more disease spreads, and ultimately the disease will drive behavior if these don't, but the disease will drive it at much higher cost of loss of business, loss of life, and loss of health and wellness. So you can read as well as I can. The recommendations are up there. For every county that's red, I urge you to do these things. I'm in lockstep with the governor. We'll talk tomorrow about which counties are red as of tomorrow. We pick Thursday so you have time to plan your next week. And by aligning what we do in schools, what we do in nursing homes, and what we do for all of the communities, if we were to do these things, I have absolute confidence that I could stand here 2 or 3 weeks later and show you a map with green counties and yellow counties and orange counties and a fraction of the red counties we currently have. But if we ignore it, that whole map's going to turn largely red, and then unfortunately we'll reach the same conclusion but at a much higher cost. Thank you very much, Governor.
Thank you. You know, while Dr. Stack was speaking, I realized that yesterday we had an opportunity to thank his Chief of Staff, Kelly Alexander, for sharing a personal story, but we didn't thank her husband, Josh, who is in a profession where toughness is important, but was willing to be vulnerable through his story being told to protect and help other people. And that's what he does in his profession too. So thank you to Josh for that. I am told the only thing he's upset about is people now know he's 40. Got one other update on a personal story today, and it's through video. This one makes me pretty happy. I know it was a little scary for a moment, but the outcome has been really good.
Hello, I'm Virginia Moore. Most of you know me as the interpreter with the governor. About a month ago, I let you all know that I was battling uterine cancer. Today, I wanted to give you an update. I am doing very well, and thanks to my doctor, Sarah Todd, and Daniel Metzinger with the Brown Cancer Center in Louisville, Kentucky, they took fabulous care of me. They were able to get all of the cancer out. So at this point, they will just be following me for the next 5 years to make sure the cancer stays at bay, but we think we got it all. This goes to, again, I want to say to women, don't wait. Please get yourself checked. On your birthday, make sure that's the time that you go and have your mammogram. Have a pap smear. Please get yourself checked. If I had waited just a little bit longer, I will definitely be in treatment because it was one of the largest tumors they saw, and it was invasive, but just shy of having to have treatment. So please get yourself checked. I am going to be excited to be back again with the governor. I'm doing a little more self-care, but I will be back. The first thing that I really wanted to share with you all, though, is my gratitude for your prayers, your concern. If I could thank each and every one of you, I would. Your kindness that you showed me lifted me up and gave me the strength to go through this. It was overwhelming and just remarkable. I want to say to you all, let's take that kindness, that support, and let's give it to everyone out there that's battling the coronavirus. I'm scared for myself, and I'm scared for each and every one of you, because this is not a virus any one of us wants or can get. Please use your mask. Let's show kindness and understanding. Let's do that one thing that we can do, and that's wearing the mask, social distance. Let's pull together as a community. Let's show everyone else the support that you showed me. Thank you to the governor's office for the support and the time off, and I will be back with you all soon.
That is great news. We are looking so forward to having Virginia back. We're so glad she's doing well. And we miss her. We love you, Virginia. All right, we'll open it up for questions. Catherine?
What that means as far as how many Kentuckians have now been impacted by this virus.
Kentucky has now exceeded 100,000 cases. In fact, we're over 101,000. And you look at a state that just has 4.4 million people, and you see how aggressively it is spread. You look at how much of that 101,000 is recent, and it shows you that we are in the worst escalation of the three that we have experienced. When you look at the incident map, it also shows you that this is not localized. And none of us can say it's not in our community anymore. And none of us should say, well, it's just in the nursing home or just in the prison in our community. It is in the community. If you're not wearing a mask, you're putting yourself at risk. That's where we are right now. There is enough COVID out there. I said it yesterday and the day before. I sat in a front passenger seat of a car next to someone who was driving, who was infectious and didn't know it. He wore a mask, I wore a mask. I did not contract the coronavirus. Thank you to him for doing the right thing. And I'm certainly glad that I was too. But people now need to not just do what it takes to protect each other, but to protect themselves. If you're not wearing a mask now, when we've passed 101,000 cases, when we have a positivity rate of 6%, when we have 64 red counties, you're putting yourself at risk. So if you don't want to care for other people, I'm sure you want to look out for number one, wear a mask. That's what's needed. You're also more likely to spread it to your family if you don't. Grace?
Governor, is there a purple rating that goes above the red? I know they mentioned that in Ohio. Just wondered if you guys have.
The question is, do we have a purple rating? Ohio does. We do not. We use about the same rating system as the White House. Actually, they adopted orange shortly after we did. And so when we hit red, that's the top level. And we need people to adjust accordingly.
A couple weeks ago, or maybe last week, you got pretty passionate about seeking congressional action to get some economic relief into the economy, and now we see that they've adjourned until November 9th. So I don't know if you've had.
Yeah, the question from John is my reaction to Congress adjourning until November 9th. Do your job. Do your job. We are in an international pandemic, the likes of which none of us have seen in our lifetime. We've lost more than a couple 100,000 Americans in Kentucky. We've lost nearly 1,500 people. We've had 100,000 plus cases here. We have more people in the hospital for this than ever before, and we have people who are struggling out there with their small business, needing a PPP loan, with their household finances, with government services, with the way that the government's been hit as well. Do your job. We have allowed, even in the midst of an international health pandemic, for Congress to be more worried about Democrat or Republican and the credit than saving lives. I think it's an embarrassment, and I hope that we learn our lesson, and in a health pandemic can just be people before we are partisan. Tom.
Governor, this is more a Dr. Stack question. He testified before legislative committee this afternoon and was talking about how the vaccine will be rolled out in the 4 phases of how it will be distributed. I have a question that's a medical question, that if a spouse gets the vaccine but the other spouse does not, because in many vaccinations and many vaccines you have a weakened form of the virus in the first place, does that put that other spouse at a higher risk of catching the disease?
So the question's for Dr. Stack, and I'll let him repeat it about the vaccine that he talked about at a committee hearing today. But let me say this. The way that some of our people are being treated in committee hearings is wrong. Listen, I ran for office. You want to attack me, you can do it. But Dr. Stack left something that paid him a lot more money to try to do the right thing each and every day. And he ought to be treated with respect, whether it's in a committee hearing or elsewhere. Trying to attack his ethics because you don't believe the virus exists is wrong. It is absolutely wrong. He has my full support, and listen, we're in a time where we need more kindness, and so we ought to see it from some of those committee hearings. All right, now the question that had nothing to do with how he was treated.
So thank you. So Tom, the question, so remember, this vaccine has been the fastest development humanity has probably ever seen for a vaccine. I mean, this is one time when the superlatives really probably are correct. And so there's numerous vaccines, each of which are a little bit different, most of which don't have any part of the virus in it. A live virus, an inactivated virus, most of them are either RNA fragments, which is a genetic material, or shards of the protein, fragments of the protein. There are some that are live attenuated vaccine, perhaps, but But there's over 100 in development worldwide, 10 in the United States, 6 that are probably getting close to finishing phase 3, and 2 that could be announced in November. And so whatever ones are approved, people have to remember there's the next step in the process. Once the FDA says it's okay to use these, then there's another committee, an advisory committee on immunization practices at the CDC, who will recommend which people are the right folks to get each vaccine. And that's where that comes into play. So they'll recommend then who it's safe to get it and who should not get it and which vaccine meets which patient. So that we'll account for that, and we'll advise very clearly who a vaccine's appropriate for and who's not.
But will a spouse count if they are connected to someone who falls in that primary category?
Oh, no. So if you get a vaccine, and it's okay for you, like if I get a live attenuated vaccine and I live with someone who they say your immune system's weak, no, generally that wouldn't be a problem, because it would not be a problem. I'm sorry, I missed that part.
All right, back to Grace.
Do you have additional security measures in place here, being put in place today? And if so, what happened? Why? There's something going on?
Additional security measures from a state police perspective?
Protecting around the mansion and other places here?
Right now, we've got the same level of protection that we've had over the last several weeks. Certainly, we have seen some things nationally and here in Kentucky that have caused us to look back at the way we handle security for everybody involved. You know, it's sad that we're having to put up a fence around the mansion, but you know, my kids live there, and what we've already seen, I'm 100% for that fence to keep them safe. But it's not just us. It's if we want a family to be able to live there and where our society is right now, it's just necessary. But no, we don't know of anything additional that's going on out there. John?
So if non-essential offices at right time are closed down, is that going to impact unemployment offices, E&Ds, county clerk's offices?
The question is on governmental offices and closing or going virtual. Our recommendation is that for every office that can still provide services virtually, that they go virtual. For those that there is an absolute requirement for in-person, we'd like them to think about how they reduce their staff, or if they've been able to provide their services virtually during other times and we still have the executive orders in place to allow them to do it. But this is the goal. It's getting everybody thinking about how we can protect one another, including those that are heading up the offices there. On the unemployment side, right now, that's all being done by telephone and virtual meetings, except for the Frankfurt in-person meetings. And if Frankfurt goes red, we're going to have to look at that because we've already had a scare. And if we end up with a spread of COVID in our folks that do our unemployment claims, then we have fewer people processing unemployment claims. We're also working on being able to provide that data. I don't know if we're going to be able to do it tomorrow in a better way where people can see exactly how old claims are. One of our challenges is when we show you March or April claims, it doesn't mean they were all filed in March or April. Someone could have filed a claim in October, but claim dates back to March. And the numbers we were showing people, that shows up as a March claim, even though we've only had a couple weeks to work on them. But we will want feedback from people and from offices about what absolutely has to be there for in-person. And then we just need to do what we should always be doing, strictly enforcing the masks, having no waiting rooms. Remember, that's part of our requirements for healthy at work. No waiting rooms anywhere. People ought to be waiting in their car until they come in to see you. Tom?
You got any more information you can pass along about some of these counties and some of these skyrocketed? What activities have led to the explosion in the number of cases?
The question is, in some counties where we see a huge outbreak, do we know what's caused it? We're now to the point where there are multiple causes of them. Now, there are some counties where a lot of the numbers stem from one major outbreak. Elliott County certainly is the prison there, but we shouldn't make the mistake of saying it's just locked in the prison. 300 people go in and out of that place every single day. That would be like saying at Lexington it's all at UK. It's not. Actually, the UK cases are going down. I know they're trying really hard, and I want to give them credit for doing that. It's that when we're red, even if you can say, well, X number of the cases that I know about are here, they got in there somehow, and they're coming out of there too. So we're to the point where we're still doing the tracing to protect people. But identifying where a cluster is when nationally over 50% of people who test positive right now can't tell you where they got it is becoming a bigger and bigger challenge. Now, we all recognize, though, that house parties, having people over, gatherings right now is one of the greatest spreaders. The White House said that today. That's something we have been seeing. And then we see events that are more personal. Weddings, funerals, birthdays. When people let their guard down, I think because it's more personal, and it feels even stranger to wear a mask around extended family, we're seeing the spread there. That's why it's really important for Halloween to be done safely, and it's why we're going to be talking about Thanksgiving once we get through Halloween, but you ought to plan for something much smaller. There's only 3 of us left. Anybody else have one? Yes?
To double check something, I think, Governor, you said 12 deaths at Thompson Hood. We're seeing 11 on the website. Is that being updated, or
let us get back to you with that. I want to make sure that it's accurate. All right, everybody. Tomorrow at 4 o'clock, we will report on the counties that are red as of that date. That's when the school recommendations, the red county recommendations, the long-term care recommendations all go into effect. Come on, let's work hard on this. Looking at where we are right now, this is a chance, community by community, to help your neighbors, so let's do it. Thanks.